Kathryn Stoltz from the Ohio State University College of Nursing. I'm a family nurse practitioner student, and I'm here to talk to you about heart failure. Now, heart failure sounds pretty scary, like the heart's not working at all, but heart failure means that the heart is not pumping blood out to the body as well as it should be, and it's not able to keep up with the demands of the body. Basically, the heart is not able to fill with blood as well or eject blood as well as it should. Some people have a combination of these issues. Your body relies on the heart to deliver blood that carries oxygen and nutrients, and when less blood is delivered to the body because the heart is not pumping as well, you may start to have symptoms. Heart failure is generally caused by high blood pressure, coronary artery disease, problems with your heart valves or your heart muscle, lung disease like COPD, diabetes, and sleep apnea. Ejection fraction is an important term to understand heart failure. Ejection fraction is the amount of blood that is pumped out to your body in each heartbeat. Normal ejection fraction is anywhere from 55 to 70%. Somebody with heart failure with a reduced ejection fraction may have an ejection fraction less than 40%. This number can be calculated through several tests, like an echocardiogram or a CAT scan. Currently, there are two divisions of heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. Heart failure with preserved ejection fraction, also called diastolic dysfunction, means your heart isn't able to relax or fill with blood as well. While patients with this type of heart failure may have a normal ejection fraction in relationship to the amount of blood that's in their heart, because the heart is not able to fill with as much blood, less blood is still being pumped out to the body. In this illustration, this is a normal heart. This is an example of a heart that would have heart failure with a preserved ejection fraction. The heart muscle here is thickened, which makes the chamber smaller, which makes the heart unable to fill with as much blood. So patients with a reduced ejection fraction generally have bigger, baggier hearts, as illustrated in this picture. This is again a normal heart. This is an enlarged heart with bigger chambers and weaker walls. People with this kind of heart failure usually have a reduced ejection fraction of under 40%. Because the heart is not pumping as well, blood backs up into the lungs and to the rest of the body. Heart failure is diagnosed by a collection of signs and symptoms. People with heart failure usually have shortness of breath, fluid in the lungs that may cause a cough, excess fluid in the abdomen, swelling in the legs, and fatigue. These symptoms are generally related to the backup of fluid that happens, as well as less oxygen and less blood and less nutrients being pumped out to the body and the brain. This is an illustration of the circulatory system. Just like in plumbing, you can think of the circulatory system like plumbing. Usually fluid is only meant to go one way. So fluid is brought back to the heart and is pumped out again to the lungs to be oxygenated, brought back to the heart and pumped out to the body. When the heart is not working as well as it should be, a backup of fluid happens, which may cause the fluid in the lungs to happen, and as well as the swelling in the legs. Because less blood is being pumped to the brain and to the body, this may also give you fatigue. So the treatment of heart failure is geared towards what kind of heart failure you have. First, the underlying cause, such as hypertension, needs to be treated. Treatment goals also include slowing the progression of heart failure and lessening the symptoms. Heart failure cannot be cured, but the goals of treatment are usually aimed at allowing you to live a good quality of life. So making changes to optimize your health with heart failure can seem daunting, but it's never too late to start making these changes. First, you can quit smoking. Smoking has harmful effects all over your body, not just your lungs, and it can cause your blood vessels to constrict down, which makes it harder for your heart to pump, and it makes your blood pressure go up. Speaking of blood pressure, it is also important to check your blood pressure regularly, and we can talk at your next appointment about what your specific goals should be. Eating a healthy diet is good for the whole family, but it is especially important when you have heart failure. The American Heart Association has great guidelines for a healthy diet, and you should keep your salt intake to less than 2 grams per day. And this is an example of what 2 grams of salt per day looks like. It may not look like a lot, or it may look like a lot. But one way to limit your intake of salts is reducing the amount of processed foods or canned goods that you eat, as well as not salting your food after you cook it. Reaching a healthy body weight will reduce stress on your heart as well, and starting with exercise and a healthy diet is a good way to start. You may have to weigh yourself every day, and the best time to weigh yourself is in the morning, wearing the same clothes, after urinating but before eating breakfast. You should record these weights every day. Getting regular exercise is important for your heart health as well. If you haven't started exercise, it may be helpful to speak with an exercise physiologist first, who may give you an exercise prescription, and will watch you exercise and give you exact guidelines on what your goals should be and how high your heart rate should go to help you get started on the right path for exercise. You should maintain your total cholesterol under about 200. You may need to take medications to reach these goals. But this will also lessen the workload of your heart by lessening the amount of cholesterol or plaque that builds up in your blood vessels. So keeping your blood sugar limited by reducing the amount of sugary beverages and sugary desserts, for example, will help reduce the amount of inflammation or further damage to your blood vessels. If you have diabetes, it's important to keep your blood sugar under control and to take your medications as directed. You should limit or eliminate your alcohol intake. You may be required to limit your fluid intake to under 2 liters of fluid per day if you're having trouble with fluid retention or swelling. This Nalgene bottle holds about 1 liter of water, so you would be allowed to have about 2 of these per day, but it's important to remember that a lot of the foods that we eat have water, and that needs to be included in your intake. Throughout your next few appointments, we will be setting specific goals to meet your needs. When heart failure is first diagnosed, you may have several appointments for testing, education, medication management, and specialists. Initially, your visits may be pretty frequent, like once a week or every 2 weeks. Once you become more stable, these appointments will spread out to every 3 months. And once you become very stable and comfortable with your routine, they may space out to every 6 months or even a year. There are several medications that are commonly used in heart failure, and if you are diagnosed with heart failure, you will probably be started on a medication. The first class that I'm going to discuss is called angiotensin-converting enzyme inhibitors, also called ACE inhibitors. They have been proven in research studies to improve symptoms of heart failure and improve survival rates in patients taking these medications. ACE inhibitors work by allowing your blood vessels to relax, making the workload on your heart easier, and lowering your blood pressure. One common medication in this family is called lisinopril. ACE inhibitors are generally well tolerated, but there are some side effects that you should be aware of. Your blood pressure may be lower, causing dizziness or fatigue, kidney damage, potassium level changes, and a cough. Some of these side effects may go away over time as your body gets used to the medication, but you should still notify your healthcare provider. A rare but serious side effect of ACE inhibitors is angioedema, or the swelling of the mouth and the throat, and if you think this is happening, you should seek emergency care right away. We may watch your kidney function and your potassium levels throughout therapy. Another class of medication that you may be prescribed are called beta blockers. A common medication from this class prescribed to patients with heart failure is called carvedilol. It works by slowing the heart rate so that the heart has more time to fill, lowering the blood pressure so the heart has less resistance to pump against, and also blocking the stress hormones that may cause worsening of your heart failure. Side effects of beta blockers include dizziness, low blood pressure, fatigue, stomach upset, and erectile dysfunction. Other serious side effects for which you should seek emergency care include serious skin reactions, wheezing, trouble breathing, or a very slow heart rate. We may ask you to monitor your blood pressure and your heart rate at home. It is very important to not suddenly stop taking a beta blocker. If you have diabetes, beta blockers can lessen the signs of low blood sugar. As heart failure progresses, you may begin to have problems with swelling or excess fluid in the lungs or in your abdomen. You may be prescribed a medication called a diuretic. Some people call this a water pill, and this helps you urinate off the extra fluid. Excuse me. A common diuretic is called furosemide or Lasix. Side effects of these medications include dehydration, imbalances in electrolytes like potassium, sodium, and magnesium. It may also cause low blood pressure, dizziness, or serious skin reactions. Please note if you're having any of these side effects as we may need to adjust your medications. If your blood pressure is seriously low or you have a fainting spell, you should seek emergency care right away. Be aware that it may take time to get your medications just right, and as your health changes, we may need to adjust your medications accordingly. And finally, being diagnosed with a chronic illness can be very difficult. You may feel a range of emotions, and this roller coaster of emotions is very normal, and it might ease over time. Numerous studies have shown that people with a positive attitude have a better outcome, meaning they have better quality of life and may live longer. It is best to face your diagnosis of heart failure head on and take control of it. Identifying ways to cope with the stress of the diagnosis is essential, such as surrounding yourself with loved ones and making sure you make time to do things you enjoy, like going to church or going to the park. The first step towards gaining control of your heart failure and having the best outcomes is fully understanding your diagnosis. You are the most important person in the healthcare team, and we cannot manage your heart failure without you. Get to know your body well so that if your symptoms change or something is worsening, you're able to recognize right away and let us know. I encourage you to ask questions so that you fully understand the reason behind each medication and the reason behind each lifestyle change we're asking of you. The lifestyle changes I mentioned before, like eating healthy and exercising, are changes that are not going to happen overnight or even in a week. Try making small goals for yourself every week, like planning a vegetable with lunch and dinner instead of just with dinner. Or try exercising for 60 minutes this week instead of 30 minutes. As healthcare providers, we are here to help you reach your goals and not scold you for slipping up and making a mistake. Slip-ups are going to happen, and don't beat yourself up about it. But get back on to your healthy habits. Maybe take this time as an opportunity to recognize maybe why your slip-up happened. For example, if you tend to eat unhealthy or overeat in front of the TV, limit yourself to just eating at the dining room table or the kitchen table. Identify reasonable goals, and when you achieve them, you can reward yourself with a healthy reward. As a healthcare provider, I want my patients to know I am happy to answer questions. I enjoy partnering with my patients and helping them reach their goals. Please feel free to follow up with me in the office for any questions, concerns, and of course, routine visits. Thanks for watching, and be well.